Everybody, this is Julie at CVIM,
Hi, Julie.
and we purposely had your microphones and your videos turned off for the moment.
Okay. All right.
Not that I'm not happy to see your faces,
It's fine.
but
I
this
just
is how we
needed to
thought we
know.
would proceed today. We have about a 35, 40-ish minute presentation planned for you.
Great.
So we have just a few people presenting. I'm going to try to have it so you see the slides and only the person who's presenting. And definitely when we get to the end, you'll have an opportunity to, we'll all come back on the screen and you'll have an opportunity to ask a few questions. We'll save a little time for that. During the presentation, if you want to ask a question, you think of something, just put it in the chat box. You can send it to me, Julie Rasenko. I guess I could turn my video on for the moment. Or you can send it to everyone, but I'll be watching for your questions and we'll hold those at the end. So let me turn the program over here to John Garvey. If John, you can unmute yourself. There we go. Here he is. And he's going to get started for us.
Great. Thank you, Julie. Hello, everyone, and welcome to the CVIM Virtual Impact Report. I'm so glad you joined us to hear about the many great things CVIM was able to do for our community in 2021. Today, we're going to share some metrics about the services CVIM provided and some wonderful stories that demonstrate the impact on people's lives. And I want to thank our staff, our volunteers, and our supporters who together help CVIM provide free, high-quality health care to uninsured working people with low incomes and help them live healthy, productive lives and ensure health equity in the Chester County region. Now, before I turn it over to Maureen, I must mention and honor Dr. Mary Worship. Dr. Mary served as medical director at CVIM for 20 years as we grew from a small storefront clinic to a large, comprehensive healthcare center. Many of you knew her, and even if you just met her once, you probably remember her. Mary was extraordinary. She was a compassionate person and physician who lived to serve people, especially vulnerable and marginalized people. Dr. Mary radiated passion, joy, hope, gratitude, and love. She touched and healed people with her medical skills, with her heart, and with her hugs. Unfortunately, Mary passed away in early February after a 10-month battle with brain cancer. And we started this evening with a slideshow picturing Dr. Mary in action at CVIM. And you could see from her costumes how much she enjoyed life and her role at CVIM. The CVIM community is heartbroken, and we share our deepest sympathies with Mary's family and loved ones. And we are so grateful that Mary dedicated 20 years to our mission and our patients. And her light lives in our hearts, and her legacy shines brightly at CVIM. And now I'd like to share a short video of Dr. Mary talking about CVIM and our patients. Her message will remind us of why we are here and why CVIM is so important to our community. Julie, can you start the video?
When a patient doesn't have health insurance, what happens is they just wait and wait and wait until they get so sick they have to go to the emergency room or often admitted. They get no preventive care. I saw one woman, a single mom. She had lost her insurance 10 years before, and she just did everything for kids. She didn't do anything for herself, and by the time she came to me, she had bleeding, she had advanced cervical cancer. She never got, they don't get preventive care. And so what I see, which I never saw in private practice, literally almost every month, a couple of people come in with blood sugars, 500. I go, what happened? Well, I lost my insurance because I lost my job. I started spreading my medicine out to every other day, every third day, and then I just ran out. We literally had a man who came in with his diabetes so controlled, he has so much changes in his eyes, bleeding in his eyes from diabetes, he completely lost vision in one eye, and we were able to help him get control of his diabetes, at least save vision in the other eye so he could work and live and function. But we have no concept that for most of us, that when you have no insurance, you live sicker and you die younger because you're afraid. If you end up in the hospital, I had a patient who all of a sudden had chest pain, needed open heart surgery. Medical bills is the #1 cause of bankruptcy. He lost his home. He lost everything because he had this emergency heart surgery. It's a very scary place for all the 27.5 million people in our country that have no insurance.
Well, good evening, everyone. My name is Maureen Tomaszuk. I'm the president and CEO of CVIM. I've had the honor and the pleasure of serving for what will be my 14th anniversary coming up in June. Thank you, John, for trying to put into words and summarizing what gift we had of Mary Worship for the past 20 years. We took a few minutes just to share some of those highlights with you. But rest assured, Mary was our leader for 20 years. We are proud to continue her legacy by our commitment to serving this community and providing access to care with our patients. My job tonight is to try to share with you some highlights from 2021 and what a year it's been. I'm also going to introduce you to Dr. Janet Jacoprero, CVIM's new medical director, who we brought on board earlier this month. And then we're going to leave a few minutes for some questions and discussion about CVIM. So please, once again, thank you for joining us, and we're going to go ahead and get started. So CVIM is a healthcare home, a comprehensive healthcare home, and it has been since day one. We offer comprehensive integrated care. Primary care, medical care, specialty care, complete dental services, and we've grown to add a very important service, behavioral health counseling, access to psychiatry services. One of our core components has been access to free medications since day one. It's very hard to stay healthy and take care of your health and be able to work if you don't have the medications you need. We also have expanded to add support services like health education, prevention, nutrition counseling, social service, and of course, vaccines, which we'll talk some more about tonight. Our patients are the backbone of our community. Low income, uninsured individuals and their families. All of those were hit hardest by the pandemic. Most of them essential workers, couldn't stay home. 75% of them are adults because kids in Pennsylvania and seniors have more access to insurance. 57% of our patients are women, and about 75% now are people of color. They have nowhere else to go. We are their only access to healthcare. We're talking about people like Miguel, who's pictured here. He's a long-haul truck driver who has a long history of out-of-control diabetes. We are able to help him manage his diabetes so he can continue to work and support himself and his family. Cynthia, a grandmother who's raising 2 children who has multiple chronic health conditions herself. And Rio, who's a 98-year-old veteran who gets his dental care here at CVIM. Last year, we served we receive over 4,800 calls from people trying to inquire about services here at CVIM. How does that happen? Well, our front desk has 2 lines dedicated to patients trying to understand how to become a CVIM patient. One is English, one is Spanish. We have volunteers who come in and just take off those calls. Call seeking information about becoming a patient increased 50% in the second half of last year when we compare it to the previous year. Our eligibility team has been very hard at work responding to these calls, screening new patients, all virtual now, and we have had to respond by adding an additional paid full-time position to this role so that we can get more patients onboarded at CVIM. In 2021, we served 4,145 individuals. More than 1,200 of them were new patients to CVIM. Our patients are so very grateful for the care they get here at CVIM. And when we ask them to give us feedback, they give us great grades. 98% of our patients would recommend CVIM. I'd like to share a little video with you showing a little bit more of our patients and their thoughts about CVIM.
We are community volunteers in medicine. Serving the Chester County region, we provide healthcare, hope, and healing for the low-income, working, and uninsured residents. Relying on volunteer medical professionals and other members of the community, patients receive the care they need so they can remain healthy and employed. Care such as complete medical and dental services, behavioral health services, medications, health and nutrition education, and social services support. And with new COVID testing equipment on site, our patients have access to free COVID tests in addition to vaccinations. In fact, 70% of our patients report they would have to go to the emergency room if not for CVIM.
I'm a patient at CVIM. Before I came here, I didn't have anything. I had no insurance, I had nothing, I had medical issues. When I go in to see a doctor there, they sit and they listen to me, and they treat me like a real person, not like a hurry up and go to the next one. They're not going to shove me out the door. They're going to take care of me.
It's no wonder why 98% of our patients recommend CVIM to family and friends. For more information about community volunteers in medicine, please visit us at cvim.org.
So what services did our patients receive? We provided over 25,000 patient visits and encounters here at CVIM last year. 15,000 of these visits were with our medical team, which is provided mostly by our volunteer providers. We offer primary care and a lot of specialty care visits. We help our patients address their acute issues and manage chronic conditions. 7,300 of these visits were with our dental team. Accessing dental care and providing oral health access is critical to our model. Our volunteer dentists and assistants, along with hygiene students, serve our patients, and we are providing that both here at CVIM and 2 sites in the community, one down at St. Rocco's in Southern Chester County and over at Surrey with our low-income seniors. Our bilingual social worker had 875 patients who needed help with all of the other social determinants of health. That means things like food insecurity, access to healthy food, employment, stable housing. They need all of this to be able to stay healthy and take care of their families and keep their jobs. In 2021, about 18% of our patient visits were conducted via telehealth, which we launched literally overnight when the pandemic hit. We started that as a way for our patients to have safe access to care. It works especially well for certain types of visits: diabetes education, nutrition counseling, and very importantly, ongoing access to behavioral health counseling and medication check-ins with our psychiatrists. The right mix of telehealth visits has been especially effective for our chronic disease patients throughout the pandemic. Now we're trying to move forward and continue to incorporate that as one of our services here because it does provide easier access sometimes for our patients.
Thank you.
One of the most important services we provide is access to free medications. As I mentioned, it's been one of our core components since we opened. Every year, we procure more than $4 million worth of medications for our patients. We have a team of dedicated volunteers and staff who apply to the pharmaceutical company's patient assistance programs. Our dispensary issued more than 27,000 prescriptions last year, and all of that is free medication to our patients. Many of these patients have neglected their health care for years before coming to CVIM because they lapsed insurance coverage. So we see people who have chronic conditions like diabetes, hypertension, asthma, that's all out of control, but it can be managed through medication and lifestyle changes. So they get that from our pharmacists here at CVIM. One of our patients is Amelia. She came to us overwhelmed by running her own business, caring for her family. She had multiple health issues and very expensive medications. The CVIM team helped her with a number of these conditions, a comprehensive medication therapy plan, and good old-fashioned emotional support and encouragement. She does take 15 medications, and just one of them cost her $1,000 a month. Now she gets them all at CVIM at no cost. With this extra care and care management, she truly understands the benefits of her medications as well as when and how to take them. She's now empowered to take care of her own health, and she can focus on her family and her business, and that's exactly what she's doing. CVIM is powered by volunteers. Volunteerism is our business model. We do have a small core staff, but most of our services are provided by our volunteers. Clinical volunteers, our doctors, our nurses, our dentists, our dental assistants who choose to come into CVIM each day and give their time and talent. We also have support volunteers that help us with data and administrative skills needed to run the clinic, and a large group of Spanish-speaking interpreters that are very, very valuable to our care. We could not achieve our mission without the generous people who donate their time and talent. And many of you are with us tonight, so we like to give you a big applause right here. Thank you so very much. Now, some of the numbers. In 2021, we had 341 volunteers donate more than 28,000 hours of volunteer time. And while that's an impressive number, it is down about 20% from the year before. The pandemic has changed a lot of things for everyone, especially our volunteers. Not everyone could come back to us, but we do continue to recruit and train new volunteers every week here at CVIM. And I'm happy to report that we onboarded 100 new volunteers last year. So if you know someone who might be interested here in volunteering with CVIM, please have them get in touch with us. If they're a clinician, we likely can use them. If they're an administrative support volunteer, we may not have an exact job for them today or tomorrow, but in all likelihood, we will in the next week or month. That's generally just how it happens. Relationships are key to CVIM. In addition to our volunteers, we rely on community partners, and you'll see some of them here on the screen right now. The Chester County Health Department has been a longstanding partner of ours and currently supplying all of our COVID vaccines. Our pro bono partners supply IT services like IT Edge. We have support to develop our brand new website, digital advertising, and other communication support, which is so vital to a nonprofit like CVIM. Our local dental association and our hygiene society partner with us every year to do Give Kids a Smile and Sealant Saturday. Our local companies and foundations supply us with funding, but also in-kind donations. For example, just this past week, West Pharmaceutical delivered over 5,000 COVID rapid home tests that we are able to give out to our patients and our volunteers and our staff, which, as you know, is critical to managing the pandemic at the phase we're in right now. Our biggest partners, our two local health systems, provide advanced additional patient care services through their charity care programs. Chester County Hospital Penn Medicine providing laboratory testing for our patients. Paoli Hospital at Mainline providing x-rays, MRIs, diagnostic studies, surgeries, and even cancer care when it's necessary. We could not do it without them. We are very, very appreciative of all the partners who stepped forward this past year to make it work for our CVIM, truly the community coming together. Well, we cannot talk about 2021 without talking about vaccines. You know, going into this, we knew that our patients trust and rely on us for access to healthcare, but information and services. It's been our goal to guide them through this pandemic. It started with education and outreach early on, turned into care management when patients were sick, and it continued right into a massive commitment to vaccines in 2021. Since March of 2021, we have provided more than 3,500 vaccines and booster shots for over 2,000 people. We began with a number of large handful events where we served hundreds of people for vaccine clinics. And we had vaccine for teens down at St. Rocco's Mission Center in Southern Chester County just before school started last year. And now we have a couple vaccine sessions each week, one offered every Monday evening. We're continue to do outreach and education. We screen patients every time they come in to make sure they are vaccinated. And that's ongoing commitment to getting all of the population vaccinated. We're proud to say that 77% of our active patients are now vaccinated. And that's about 10 points higher than the overall statistics for Chester County. It's taken every one of the staff and volunteers to get that done, and we couldn't have done it without them. These patients weren't all vaccinated here at CVIM. That wasn't our goal. It was really to get them vaccinated the quickest and the easiest place to get that done. So we made sure we provided information when there was community clinics so that patients could get there. One of the most people thrilled to get her vaccine was Emma Jesse, who you see in the picture here. She came with her husband and her mother. All of them have a chronic health condition that make them extremely vulnerable, and they were very worried. As you can see, they had already lost 2 extended family members to COVID. We can't see the smile on their face in this picture, but you could see the excitement and feel it. And I think everyone remembered them when they came in that day during the vaccine clinic. Well, so what's happening for going forward? CVIM has experienced really over 10 years of growth, but the last 4 years, it's been substantial growth leading up to the pandemic. A 47% growth in the patients that we're serving, 18% growth in the volunteers that we were able to add, and 21% growth in our fundraising revenue, which, as you know, 100% supported by the generous community and the philanthropy. The pandemic disrupted everything for all of us, and in healthcare in general, it's changed everything forever. We know that the pandemic is going to be still with us. We can't predict what comes next. We're really hoping the worst is behind us. But during 2021, we committed to conduct strategic planning to look at CVIM for the future beyond COVID. We took a lot of time to look at the lessons learned at the pandemic, study our strengths, our opportunities. We studied community needs, our patients' needs in particular. We looked at all the programs, services, and operations, and we developed a thoughtful strategic approach to guide us for the next few years. Early in the planning process, we revised our vision and mission statements, which you see there. We really just tweaked a few words. The core positions remain the same. Our purpose is to provide access to care for people who fall through the gaps in our local health system. We are the safety net provider. We are serving people who otherwise depend on an emergency room for their care. And I think we all know that right now and always, the emergency room is not where you want to get access to care. We address health disparities, and we work towards creating health equity for this community. Our credo. Well, those of you who know CVIM know that the Volunteers in Medicine model was started over 28 years ago with the first Volunteers in Medicine in Hilton Head from Jack McConnell. And the credo that hangs on our wall still remains there today. May we have eyes to see those who are rendered invisible and excluded. May we have open arms and hearts to reach out and include them. And may healing hands touch their lives with love, and in the process, heal ourselves. That remains very much part of our CVIM model. Our strategic plan, it's a three-year plan. Very hard to look farther down the road than that. Looking to the strategic plan is really about how we can continue to meet the growing community need and about improving health equity in this community. We're just starting to roll out the plan and it will continue to evolve. Our intent is to strengthen CVIM so we are prepared for all the challenges that lie ahead. At the highest level, we know that we will focus on these three things: improving access to care, ensuring that we have the resources needed to support our growth in services, and measuring our outcomes to improve programs that demonstrate this impact. Improving access to care. CVIM was founded to address all the disparities in our local health system. We do that providing access to high quality care for the patients and the people who face barriers in the community. They primarily lack insurance. They're also low income. They have language barriers. They have cultural and transportation barriers. It's clear that the demand for our services is not only present, but it continues to grow. We have some waiting lists in some key areas of services that we have prioritized to address. For example, right now, we have a generous supply of volunteer gynecologists, and we have a high number of women who need access to women's health. But right now, we need to hire a GYN nurse to support them so we can address the waiting list and provide all of the procedures that our women's healthcare program offers. Our waiting list for eye exams has grown over the pandemic to exceed over 100 patients. We have plans to address this now with a couple of new partnerships, I'm happy to say. Salus University is the local ophthalmology school, and Siegfried Eye Institute is a large regional private practice. Both have come forward and are partnering with us for the future. We have a new eye exam room that's going to be launched and a potential resident rotation with our Salus University. So we'll keep you informed as we move that forward. We're also looking at telehealth and how to work that into our model going forward. We're exploring the idea of what we're calling a telehealth microsite. It's a small office in the southern part of the community where patients can have private access to space that's equipped with state-of-the-art technology, robust internet service, and they could have access to a CVIM volunteer provider who's here. This will address many of the challenges our patients face. We also were focused on restarting our transportation services for our patients. This was suspended by the pandemic. We used to have a volunteer driver program that was providing up to 150 rides a month, and requests for those rides were greater than that. We're looking for the best way to get that back and running, and I'm happy to say that some of the volunteers who are doing those rides are still interested in coming back. We're looking at the way to make sure that our patients get here for their appointments. They don't have no-shows because of transportation, and public transportation is very limited in this county, and it doesn't necessarily work for our patients. So we're committed to re-offering transportation services for our patients. Looking at growing and stabilizing CVIM, we have to stabilize our resources. Of course, we need resources to bring this plan to life. Our initial projection is that we would need an additional over $2 million over the next 3 years. That's about 20% more than we generate now, so we have to address that. You all know this, but I'm going to remind you anyway. CVIM is 100% supported by philanthropy. Our patients don't have insurance, so we don't bill them for reimbursement. We don't have government contracts. We raise the money by the generosity of this community. We are definitely looking at how to do that and prioritizing an endowment campaign for the next cycle of 3 years. We're looking at how to support some of the key staff positions like our medical director and our dental director. That would ensure that these vital positions are secured for our future, and we would start off each fiscal year knowing that those items are covered in our budget. We are always looking for new volunteers. They are an essential resource. That is what we could not provide this model of care without them. We wouldn't even try, but we need the community's help to help us with that. So we will be focusing on that. We are also looking at health outcomes. We talked about increasing access to care and the resources it will take to do that. We need to improve our ability to measure and report outcomes, not just numbers. That means knowing how many patients we serve, and the services they receive, but what impact did those services have on them? Is their blood pressure lower? What about their blood sugar if they have diabetes? We know these things about individual patients and use those metrics to guide their individual treatment plans, but we need to aggregate that data and tell it in a bigger picture way and compare it against benchmarks. I will tell you, we know that we're doing a good job, but we have to be able to show that we're doing a good job. Better monitoring and reporting outcomes will help us do two very crucial, important things. Monitor our overall clinical quality and evaluate the effectiveness of our programs, and demonstrate the impact to all of our supporters and our foundation funders. It helps us tell our story better. And as you know, telling the CVIM story is what allows us to continue to do this. And our funders want more information. So it's our commitment to do that. And now, I would like to take a minute. I've shared a lot of information with you. I know you may have some questions. Put them in the chat box. We will open things up and discuss them as we move forward. But it's my pleasure to introduce Janet Checaprero, our new medical director, who is going to help lead and move CVIM forward with all of these initiatives. She's eminently qualified for this role, having served previously as a medical director of 2 different community-based healthcare centers in Baltimore. Not long after moving to this area a few years ago, she sought us out and started volunteering here at CVIM while she was practicing. I'm going to ask Janet to talk now and share a few thoughts, but I will also share with you that back in the fall, Mary was part of the leadership team that helped us select Janet. So let me reassure you that Mary knew that CVIM was in good hands. So Janet, I'm going to turn it over to you.
Hi, I'm Janet. I'm thrilled to be able to introduce myself to you this evening as the new medical director at CVIM. I've been here just over a month now, and I'm as challenged and inspired as I had hoped to be. As Maureen mentioned, before joining the staff at CVIM, I was a volunteer for about 8 months on Monday nights. That's while I was still working full-time as an internist in primary care for Penn Medicine at the Whiteland office in Exton. And my goal volunteering here was really to maintain the skill set that I developed while working with underserved populations in Baltimore, Maryland. I graduated from the University of Maryland School of Medicine in 2003 and completed my residency in internal medicine at Johns Hopkins in 2006. After that, again, as Maureen mentioned, I served as the medical director at 2 Baltimore-based federally qualified health centers before moving to Glenmore, Pennsylvania with my family in 2019. I was drawn to the practice of medicine and to primary care in particular because I've always been interested in people's stories. The most rewarding experiences in my career have been while working in community health centers like this one, partly because I find those patient stories to be the most compelling, and partly because I enjoy working alongside others who share my mission and core values. I've found that the team-based approach is the most effective for conceiving innovative solutions to complex healthcare challenges that are patient-centered and powered to transform the delivery of healthcare. I've already seen firsthand how well CVIM works as a team with a new patient whom I'll call Elena. She was treated at a local hospital for kidney stones and discharged with a nephrostomy. This is a tube that drains urine and stones from the kidney to a bag that's secured to the patient's back. It requires the care of a urologist, but the patient was uninsured and was advised to contact us when she was discharged. With the help of our social services coordinator, Karuna, and our eligibility associates, we were able to expedite her CVIM eligibility, processed in only a single day. And we're able to get her into our clinic to see Dr. Susan Kennedy, who worked with our patient care coordinator, Haiti, to connect with the Temple Urology Resident Clinic for nephrostomy care. She was just seen on Monday. We're also in the process of recruiting a urologist for our in-house team, who we expect to start at CVIM this summer. So you can see that this is truly a place where patient-centered medical care that demonstrates the importance of our collaborative relationships with outside hospitals, as well as the value of integrated services under the CVIM roof. We're pleased to be able to offer this high standard of care for our patients every day with your help, thereby caring for our neighbors and community in a way that honors and perpetuates Mary Worship's legacy. Thank you so much for your time and for your support of our work here at CVIM and for welcoming me.
Thank you, Janet. And now I think Julie is going to take over and open things up, right?
Yes, so Carolyn, I'm gonna ask you to take the slides down. And anybody who wants to, you are welcome to turn your camera on so we can see your faces instead of just your names. And if you do have a question, you can look for the right opportunity to raise your hand or unmute yourself and say something. That would be very welcome. Can you get your cameras off? I can't do it for you. I think you have to do it yourself. Anyway, I'm going to start with a couple of questions, one for Maureen and one for Janet. Maureen, you talked a little bit about the vaccines that we focused on in 2021, but can you speak a little more to like year 2 of the pandemic and what that was like here at CVIM?
Well, it was, continuously gathering the team to address the latest information. As you know, things were evolving and the pandemic and the impact on individuals, the community at large, was happening in real time. And so we needed to gather almost every day, at least in the beginning, and then weekly, to address the latest kind of protocols, which we called house rules. So all of you who are volunteers who have constantly saw the new house rules in your inbox, so that we gave out very clear, consistent information so everyone knew what to expect, particularly when we were welcoming our volunteers back to CVIM to serve on site, and how to address, being in the clinic around other individuals, the number of people that we were going to have in the clinic, and constantly evaluating that to respond to, the latest and greatest. We switched also from directly working with the state of Pennsylvania to receive vaccines here on site at CVIM, which was a very cumbersome, intensive process, to working locally with our health department when things started flowing, and that proved to be, essential to getting real time, whether we had 100 we needed for the next day or 25, we were able to work with the health department to make sure that we had, the vaccine integrity and be able to have everything, all the supplies we needed to vaccinate the patients who were scheduled. So it's been ongoing communication and then ongoing communication with our patients. As I mentioned, we were focused on being a relayer of very valid information to our patients, making sure they knew that we were open first and foremost, how to reach us, and to how to get a hold of us if they were sick, to manage their symptoms. We brought on a nurse practitioner who became our COVID case manager just to take those phone calls and talk to patients every day. And she knew if they called back the next day and their symptoms were worse, that we had to take the next step and address them, and what they needed to get. I'm happy to report now that we're able to do COVID testing on site, PCR testing. We were able to receive funding to be able to purchase and secure that machine, which can do not only COVID testing, but flu testing and testing for other viruses and respiratory illnesses. So that's really helping build our sustainability to respond in the future. And as I mentioned, now we're able to get all of our patients and volunteers the rapid home tests that they need. And we're really working with the latest protocols if someone has had an exposure, has symptoms, because we have found people who wake up feeling not well. They're able to test and realize that it's not COVID. So it's been great.
And Janet, just one follow-up question for you. It was briefly mentioned about the social determinants of health, which doesn't roll off the tongue for everyone, but a lot of people know a little bit about that. But can you say a little bit more about working with patients in our population and what those social determinants of health are?
Sure. So social determinants of health are all of the conditions that impact people's health and quality of life. So things like safe housing, whether you have access to transportation, whether you have access to healthy foods, areas to exercise, clean air, clean water, what kind of educational and work opportunities you have, if you're affected by racism, discrimination, and violence in your community. And poor social determinants of health have been shown to increase the risk of a lot of different diseases, including sort of the big three: heart disease, diabetes, and obesity. They've been associated with lower life expectancy as well. So these are things that we try to address, certainly with our population. while we're trying to care for their health needs. Our allied health staff help us tremendously with this. So our social services coordinator can help with rent assistance, connect patients to food bank, help them with clothing. Soledad, who heads up our behavioral health program, can help address mental health needs. We have Carla, our diabetes case manager, who can help patients learn to make healthy food decisions and incorporate regular exercise into their lives. And then, of course, having free medications relieves patients of that financial barrier to getting their healthcare needs met. So there's a lot to it. There's a really nice report in Healthy People 2030. This is something that our nation puts out every decade with some objectives to improve health and well-being in the population. And the 2030 plan includes about I think over 300 sort of objectives. And I think 20% of those are related to social determinants of health this decade, which is new. So this is something that's being newly recognized as impacting people's health.
Thanks. So that turns it over to everybody. If you would raise your hand or speak up and let us know what kind of questions you have and what you'd like to talk about. Maybe we'll check the chat box here. No more questions in the chat. No questions at all. Come on. These people have their cameras on. Lisa Kearns is raising her hand, it looks like. Lisa, can you unmute yourself?
I can. Thank you for that. Quick
Mhm.
question. I think I heard you say that you don't have any government funding or grants. And did I hear that correctly? And is there a reason for that?
I can answer that. So we don't have regular government funding or reimbursement. We do get to apply occasionally for grants. It's been through the State Department of Health when they're made available. They're competitive grants. And I'm happy to say that we have been successful on a number of occasions to receive that. They are time limited. They're specific to expanding access to healthcare. I'm happy to report that one of those grants was what allowed us to open our 2 satellite dental clinics, one down at St. Rocco's and the other over at Surrey for our low-income seniors. So one occasion we are able to apply for those, and we recently applied and just had a call with the state today to understand the opportunity to receive funding with our telehealth microsite idea. So they're really looking at expanding access to care, and we were able to successfully put together a request showing how our patients who live at the very southern part of the county, who don't always have cars, who are low income, meet our criteria otherwise but couldn't get to us. They don't have internet, they don't have a home computer. If they become CVIM patients, which right now we're doing all virtually, trying to make it easier for them to do, but if they don't have those basic services, it's very hard to conduct those visits. So we were just informed, as I mentioned, that we are going to receive the state grant to expand telehealth services at a microsite.
The one exception to that on the federal level too is that we do have the federal government's assistance with malpractice insurance. So all of our clinical volunteers are covered by the Federal Tort Claims Act, which is provided to us through the federal government.
Excellent. Thank you for that. And just one other quick question. The closing of generousville and Coatesville, what impact do you think that's going to have on your services and your demand for services?
Great question, Lisa. So I've been part of a community group that's been organized by the Alliance for Health Equity out of Coatesville. Community leaders trying to work to address that on a number of levels. Of course, there is a whole group that remains positive that something's going to come of those sites, but in the meantime, we're working to address the access. So one whole group is responding to the emergency medical services and the transport. EMS, the county is running the coordinated response to that. And the other group is trying to expand access and look at partnerships and leveraging funding to help improve services. And we've been talking about being able to offer additional services like our telehealth sites that we were talking about, But it's really going to be informing those funders and making sure the funding goes in the right direction to improve access to care and services. There's also been a huge discussion about the transportation challenges in Chester County. It certainly impacts our patients trying to get to health appointments. It impacts our patients when we get them an appointment at Paoli Hospital for a specialized diagnostic test or surgery, and they can't get there. So transportation in general, and trying to alleviate patients who call the EMS service when they really could have some other type of transportation. So yes, everyone in Chester County is aware our volume is up, our phone calls are up. So we have added eligibility screener to try to, and supplemented that with some temporary help in addition to the new full-time employee to try to take more calls and fast track people's eligibility process to make them CVIM patients. It's ongoing work though.
Excellent. Thank you for your help and thank you for all you do.
Thank you.
Anybody else have a question? Susan Sandler, thank you for your nice comment in the chat box. You can put comments there if you like, or use the little reaction button to raise your hand, or just wait.
Julie, I have just not so much a question, but a comment. It's Jay Siegfried. I'm a weekly practicing physician. I am the physical medicine doctor who does much of the musculoskeletal care and pain medicine on a weekly basis. And I'd just like to say that pursuant to the earlier tribute to Mary, after Mary's untimely departure, Dr. Renee Cassidy, who had taken on the interim medical director position, but only had the time to do it part-time, did just a remarkable job. But there's only so much you could do, and when you're interim, you're interim. You know, you do what you have to do, and you put your finger in the dike when you can, and she moved us ahead. But I have to say that I've spoken to Janet a few times, and now that Janet's there on a daily basis, I see on a weekly basis, it makes a huge difference. The leadership and new eyes are looking at how we do things, and innovative changes will come, and the details that we really need to look at are being looked at. So I as a board member and as someone who's seeing patients on a regular basis, I'm very optimistic about the CVM's future and the quality of care that we do, how we do it, and how we document will all be very well taken care of. And I'm so pleased that Janice joined us.
Thank you so much. Big shout out to Renee. She did a wonderful job at sort of paving the way for me to come in very smoothly.
She sure did.
Yes, she did. So
I
thank
am
you.
eternally grateful to Renee for stepping forward in what was an extremely sudden and challenging time. We couldn't have done it without her, and she's taken off a little bit of time here in February, and she'll be back in the fold with us, you know, in some capacity to continue to support CVIM.
Time for one last question before we have closing comments. Anybody? Not seeing that. I'm going to give it back to you, John, and ask you to close us out.
Great. Thank you, Julie. And thank you everyone for joining us. You make possible everything that you heard here through your contributions, your service, and your partnerships. And please, if you have any further questions, don't hesitate to reach out to us. We'd be happy to answer them. And if you haven't been to CVIM in a while, we would love to show you around. Yes, we are doing clinic tours again with COVID safety protocols in place. So again, thank you so much for being part of the CVIM story. Have a wonderful evening. Good night.
Thanks, everyone. Good night.
Good night. Thank you.
Great to see you all. Thank you.
Thank you. Good night.
Thank you. Excellent
Thanks a lot.
presentation.
Thanks.
Fabulous presentation.
Thank you.
Well done.